even just something that's home cooked is still going to be way less pre-digested than kibble or canned dog food. You know, you add some water to kibble, and what happens to it? It just turns into a big bowl of mush. Like the little particles are teeny tiny. You add water to that, and they get absorbed extremely quickly. Insulin levels go up way fast. So, what does a diet look like? This dog seems to have the answer. Meat, and ideally as minimally cooked as possible. Now, some of you may be uncomfortable with the concept of giving a raw meat diet. Well, I can tell you that commercially manufactured raw meat diets are subject to the same level of scrutiny, or more probably, as a kibble diet. So regardless what misgivings your veterinarians might have about them, or you might have about them, they are safe. However, you don't have to give a raw meat diet if you don't want to. Even just something that's home cooked is still going to be way less pre-digested than kibble or canned dog food. You know, you add some water to kibble, and what happens to it? It just turns into a big bowl of mush. Like the little particles are teeny tiny. You add water to that, and they get absorbed extremely quickly. Insulin levels go up way fast. You compare that to eating a steak, or whatever you can afford, or a meat and vegetable diet where the dog has to do the work and has to do all the breaking down that the factory is otherwise doing. It takes time to absorb that, and they don't eat as much. If their stomach is distended with more water and more fiber in the food, which of course don't have a caloric hit. So that's the number one goal. The food should be less digestible, more water, more fiber. Now, whether you want to go with raw, whether you want to go with homemade, that's fine. It doesn't really matter that much. What about, you say, just logistically, that does not work for me. About as processed as you can get in the way of a diet before you start to screw things up metabolically with insulin and cortisol and all that is a freeze-dried diet. So you can buy freeze-dried diets at a lot of pet supply stores, and then you're buying something out of a bag, which makes your veterinarian happy, and you have the convenience of bagged food, which makes you happy, and the diet is not optimal, but it's okay. Your dog won't get better as quickly. It may not get all the way better, but for some of you, that may just have to be the compromise that you make. Okay, so that's how it's working. Its insulin levels are much lower. The animal's not eating nearly as many calories when it fills its stomach up. That combines to lower the amount of cortisol that's being secreted directly, the amount of cortisol that's being recycled by the liver, and the overall sensitivity of the body to even normal cortisol levels. And what that means is the symptoms slowly start to go away. Now we can speed that up. The main formula that we use is something called 4 Marbles combination. And this was originally developed, probably 700 years ago to treat entirely different things. And it's a measure of how well it works and how in dog adrenal gland problems that now you can find medical research articles on the use of this formula to treat hyperadrenocorticism, to treat Cushing's. This is the most commonly used Chinese herbal formula, anyway, in North America by veterinarians, hands down. Because this is a big problem. Why is it a big problem? Because everyone's eating processed food. So it doesn't just treat Cushing's. It treats a lot of other things that are tied to insulin and tied to food that's too rapidly assimilated. Chronic inflammation, of course, and acute inflammation, flare-ups being the big thing. Essentially a herbal corticosteroid, if you will. And in fact, any dog that is changed corticosteroids in order to feel normal, to manage their inflammation, we can lower the doses used of prednisone, dexamethasone by teaming those drugs up with this herbal formula. And when we do that, then you run less risk of overdosing your dog with prednisone and dexamethasone, How do you know your dog's OD'd on those drugs? They look like they have Cushing's. So this doesn't just treat Cushing's. It helps prevent the development of what vets call iatrogenic Cushing's, which sounds like a much nicer way of saying, oops, I made your dog get Cushing's by giving him too many drugs. Just call it iatrogenic, and it's suddenly we can preserve our professional dignity. Anyway, so safe to use in these symptomatic cases because it doesn't nuke the adrenal glands. It just normalizes the adrenal glands. When their adrenal gland is being stimulated by the brain, there's just less cortisol being released. And there's just a lower overall cortisol secretion from the adrenal glands. It's still being made, it's still being secreted, but just less. Berberine in there also goes to the other cells in the body and says, stop overreacting to cortisol. It's okay. It's going to be around. We're always going to have lots of it, so everybody just calm down. And then the final thing this formula does is it normalizes insulin levels, and so it's being used a lot. There's several articles on the use of this formula for the treatment of diabetes, type 2 diabetes in people, which of course is an insulin resistance problem. Way high insulin producing lots of physiological problems. So whether we're talking about insulin, whether we're talking about cortisol, whether we're talking about cranking it out for the adrenal glands, when we're talking about overreacting to it, boom, 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 Sumyasan 4 marbles combination handles it all. Now it's not free of side effects, despite the fact that it's a herbal formula. So sometimes there are other insulin sensitizing herbs that we use, and so this isn't a one-size-fits-all kind of situation, but it's a one-size-fits-most. Probably 75–80% of the dogs that are out there suffering those classic signs of Cushing's, at least. You know, the more that they're kind of hot and hungry and thirsty and restless, the more that this will be relatively a relative no-brainer in terms of a herbal prescription. So what is it going to look like, this result of this no-brainer prescription? Well, if you get the diet and the herbs in play, then usually within a few weeks, your dogs are looking dramatically different. This is true even if you don't start them on drugs. So in our clinic, we don't start them on drugs, even when we have that diagnosis. Under veterinary supervision, we feel comfortable even in just stopping those drugs because we know this works so well. Now, if you don't have a veterinarian on board helping you with this, I don't know if that's a good idea. So what you could do is keep up with your trilisting, keep up with your pharmaceuticals that you're using, but if you suddenly find that your animal's getting tired and showing the signs of adrenal glands suddenly being too calmed down, to hypofunctioning, that's your cue to start lowering the drug dose. And you might have to do that relatively quickly within the space of the first 2 or 3 weeks of treatment. And it's not the herbs that are creating that. It's not the diet that's creating that. You now have a more normal dog. And anytime you give a drug to a normal patient, you're going to get the typical signs of the side effects of that drug when you use it too much. So don't stop the herbs, don't stop the diet, cut back on the drugs, and then you'll be able to do that again and again and again. Eventually your dog will be symptomatically normal, off drugs, and probably eventually off the herbs too. That's why we call the talk curing Cushing's. Now, it doesn't always work. Some dogs have a lot of problems going on, and it's not quite so neat and tidy in terms of getting them off herbs, and they're just like a healthy diet maintains them going forward. But the majority of cases, if that's all they've got going on, that's what's going to happen.